I'm Dr. Pri, and this is the Longevity Now podcast, where we distill insights from the frontier of longevity and preventive medicine to help anyone live healthier for longer. This person is asking what add-on tests should be done for migraines. So really what biomarkers can be used for migraines. They've had bad migraines for the past 6 months. They haven't been able to find any causes and they want to get some better answers. So I wanted to take this opportunity to talk a little bit about migraines and what you can do to try to prevent them, and including what blood tests to get. First off, migraines are a lot more common than you would think. I actually have a couple patients with migraines, but 14 to 15% of people globally suffer from them at some point in time. That doesn't mean they have migraines all the time. They tend to peak around the ages of 35 to 40, and they even see 7 to 10% of school children have migraines. So you get a whole range of folks who are suffering from migraines. So it's a big problem here. First step to preventing a migraine here, and this is a great article from the American Academy of Family Physicians, AFP. Highly recommend it for folks who are looking for good medical information. Common migraine triggers, additives. So these could be additives like things to your food. MSG is an example that used to be talked a lot about in the US, but in general, any kind of additive processing to food. Alcohols, artificial sweeteners, the Diet Coke could be the thing doing it. Caffeine, having too much or having a withdrawal that can then trigger a migraine. Just being hungry, working out, and it's usually working out in the cold or something more specific, not just any exercise that's triggering a migraine. Certain foods, chocolate, soft cheeses, light, menstrual periods, smells, sometimes people driving at night, those lights, oral contraceptives, which is kind of related to the female hormone there, having depression or anxiety can sometimes trigger it. Red wine, some sleep disturbances, smoking, stress, and weather changes. So there's a lot of things that can trigger it. The first step is to figure out if there's an obvious behavioral trigger that's setting them off. And as this person said here on Reddit, they have not been able to figure out what the triggers are with their PCP. So their primary care physician, their doctor did the right thing in trying to figure out what is the trigger. Next, what are some supplements that can help with this? So I'm going to zoom in here. This is a little sheet I share with my patients. And how can we check these? Because really, this person's question was, what can they add on to Function Health to help with this? Well, some supplements here. Coenzyme Q, you hear that on the cardiac side. There's some evidence that 100 to 400 milligrams a day can help. Typically, I would say the studies have shown 300 milligrams a day help, but you never know. You can test it out. These are reasonable quality evidences, and you can get a plasma CoQ10 level, although it's an unclear how correlated that is to what you're really looking for, meaning how do you correlate that plasma level to, one, the intake of the supplement, and also if that's going to prevent your migraine. So I don't know if I would get this plasma CoQ10 test, to be honest with you, but I think it would be reasonable to check it out. Magnesium citrate, this is essentially magnesium, 200 to 600 milligrams a day. I've heard higher, closer to 400 is going to be better here. And the way to measure this is through RBC magnesium, which is a red blood cell. It's a blood test, but they look at how much magnesium is in your red blood cell. And anytime you have a test that looks at the red blood cell, it's getting a sense of how long. So the red blood cells last for 120 days on average. So it gets you a longitudinal view of what has happened in your blood. So another example of this is hemoglobin A1C. So that's your average blood sugar over that 120-day period. So magnesium, RBC, is your average magnesium in your blood over that period versus just a snapshot if you get a regular magnesium blood test. Melatonin is another one where there's some evidence. It's low quality evidence, but hey, you can try it out. If it helps, great. This should say 34 grams in the evening. Omega fatty acid. Oh, and on melatonin, there's no good biomarker to assess that. Omega-3 fatty acids, fish oils. So these help reduce inflammation and help with your vascular health in general. You hear about them a lot for different reasons. EPA and DHA are the big ones that you're looking at. In terms of the dose, you want to base it on your blood levels. So this is one where we do have a good blood test, omega-3 index. This is another one of those red blood cell tests. Riboflavin, which is vitamin B2. 400 milligrams a day, some moderate quality evidence for that. And you can do a blood test to check your levels there. Vitamins B6, folate, which is B9, and B12. So this is really trying to make sure your homocysteine levels are lower. And there's some decent evidence on this. Also, similar to omega-3 fatty acids, homocysteine helps reduce inflammation in your blood vessels, and help just with blood vessel health in general. And I would base the amount of these vitamins on your homocysteine levels. If they're normal, great. If not, try some of these out and get those levels normal. And finally, vitamin D, which is talked about a lot. And vitamin D, you also base it on blood levels. So there are biomarkers for assessment. So to summarize, I would definitely get a vitamin D level. I would get a homocysteine level. I would get an omega-3 index, riboflavin blood test, RBC magnesium. Consider the plasma CoQ10, but again, I'm not 100% sure how much that is going to help. So that's to answer this Reddit user's question directly. Lastly, there are a few medications that you can use to prevent migraines. The most common ones being beta blockers, metoprolol and propranolol, but there's a few more other drug classes, anti-seizure meds, something called CGRP, monoclonal antibodies. And for people who have a lot of migraines, you can actually get Botox. So if you have more than 15 headaches a month, your insurance will cover Botox for this. So this is a common cause.